Hi, everyone. It's John Sharp, Heidelberg University Stoner Health and Counseling Center. I'm here with an old friend and an alumni of Heidelberg University, Dr. Chris Phillips. Chris, like to introduce yourself? Tell us a little bit about who you are, what you do.
Yeah, sure. I'm Dr. Chris. I graduated from Heidelberg back in '06, and then hung around for an extra year as a graduate assistant wrestling coach, and then went on to chiropractic school in Atlanta at Life University. I was there for 4 years. Moved to Texas after that. Got to Texas in 2011 and opened my practice and started practicing. About 5 years later, I opened a second practice in Dallas, and I have doctors in each clinic. I kind of bounce back and forth, just running the clinics and consulting with different doctors, coaching different chiropractors around the country, just trying to help them out with business and treatment and things like that. So
Awesome.
yeah.
So talk to us a little bit about the treatment you provide, maybe even a little bit about your treatment approach. How do you treat patients walking into your clinics?
Right. So I guess everyone, every patient is different. So they see us for a number of reasons. Most people come to a chiropractor, seek out a chiropractor for things like back pain, neck pain, headaches, different things like that. We get some off the wall stuff from time to time too, but we just kind of do an overall assessment. In the beginning, we'll just see what's going on, address the patients and their complaints and see how they're doing. But beyond that, we dig into their lifestyle a lot too. So we have what we call our spinal health assessment and our health risk assessment. And basically, it's a questionnaire about your lifestyle. We want to find out how you're eating, how you're moving, and how you're thinking, basically, because those are kind of our three tenets of health. We're constantly talking about eating well, moving well, and thinking well to help patients. And really, we're not treating anything individually. We don't, a person comes in with low back pain. Yes, we assess the low back pain, but the big thing is to get the patient functioning correctly again and living a healthier lifestyle, because back pain is usually just one of the side effects of their lifestyle and their work and everything else that goes into that. So we assess what's going on in their life, how they're eating, moving, and thinking. We put them through some movement exams, a little physical exam. We take x-rays to see if there's anything going on there and help us with our care plans. And then, depending on the patient, we see them however often and however many times we need to. And we work towards a wellness lifestyle. We've developed a 90-day what we call our 90-day lifestyle plan. Basically, it's an online program that we do for our patients. We get them adjusted probably twice a month, most of them, but we send them meals, their meals for every single meal, recipes. They can interchange stuff. You don't like chicken, you can change it to fish or beef or whatever, however it works. And then we send them an exercise routine for every day, changing it up each day. And then also some positive thought exercises. Stuff like gratitude journals, just different things, different exercises that they can do to make sure that they're mentally staying on top of stuff, book suggestions, things like that. So that's our ultimate goal for everybody, is to kind of get them in that 90-day plan so that we can help them make real changes in their lifestyle so that they don't see the deterioration in their health and things that brought them into the office in the first place. So
Awesome. Yeah, I like that full life assessment and addressing all the things that go into that. And obviously, being my side of things is the mental health, the thought side of things. That's very interesting that you incorporate that as well, kind of that positive psychology side of things that I'm kind of hearing you say. So talk to me more about that. So do you ever treat anybody with mental health issues as a main referrals idea, or secondary? Do you ever deal with anything like that?
yeah, I think typically it's not the main reason we see people, but more often than not, it is a secondary that's going on. You know what I mean? So for me, it's one of the biggest things. I don't think you can be truly healthy without eating well, moving well, or thinking well. I don't think one of them weighs more than the other either. I think it's very important to address all of them. So we see a ton of it. I actually work with a couple of different mental health professionals in town when we see something that's kind of out of our scope or whatever it might be. But a lot of times the mental stuff that we see are people just extremely stressed out, extremely frustrated. Pain leads into that. your diet leads into that. I mean, it's an all-inclusive thing. So I wouldn't say, I really treat any mental health disorders, but I wouldn't say that I treat asthma, or I wouldn't even say I treat back pain, right? What I treat is the human, is the person themselves and their lifestyle. I think I address more lifestyle than anything. And that when you treat yourself right, when you start having a correct lifestyle, eating well, moving well, and thinking well, creating a kind of a baseline health, then you start to see that back pain goes away. Things like allergies and asthma start to clear up when you start changing your diet and change how you're moving and thinking. And I see patients all the time with depression or anxiety or symptoms like that they didn't come see me for, but things like that start getting better because they start to, take care of themselves and live a lifestyle that's compatible with our genetics, with our genome, with our species type, and just how we evolved and everything. So
yeah, I kind of see that same thing too on the flip side of mental health issues, and we talk a lot about basic needs: food, sleep, exercise. That can go a long way to help out our clients, in the mental side of things. You mentioned the term baseline health. Can you define that for us? Can you talk a little bit more about what that is?
Yeah, absolutely. For me, baseline health it's homeostasis in the body, right? We have so many things, so many different mechanisms, so many things going on in our body that are supposed to happen that prepare us for things like the current situation that we're in the nation, right? For different viruses, different bacterias. Our bodies are really well equipped to handle these things. It's just we've left baseline health, right? We've started eating like our species has never eaten before. We have terrible diets now, right? So we're not feeding ourselves the right things. So that takes away from our body's ability to defend itself. We're getting away from baseline health at that point. So I guess the easiest way, maybe a word that would be easier than baseline health, would be homeostasis for people, just giving your body what it needs. And the simplest terms that I can boil that down to are the eating well, moving well, and thinking well, which there's a lot that goes into that, right? We're a complex organism, but if we take care of ourselves the way our species is intended to be taken care of, we eat the foods that our ancestors ate. We get the movement in that people used to get in. We're stuck at computers all day long. We're stuck at desks. Right now we're stuck at home, right, with nothing to do. So that makes it even more difficult. We're not moving at all. And they've shown in study after study after study what a lack of movement does to your mental state. Right. And you're hard pressed to find a study where a depression medication outperforms exercise when they compare them to each other. And it's, and that's the same thing when you look at the mental side of it, it leads to the pain side of it as well. It's, if you don't have movement, one of the oldest laws in medicine is Hilton's Law. And that's what I try to explain to all my patients. If you have a joint in your body that's not moving correctly, if your elbow doesn't move correctly for a year, if we put a cast around it, the muscles are going to get smaller. The skin's going to turn a different color. You're going to have less sensation. It's going to get sick. Your elbow is. Well, for every single joint in our body, there's cortical mapping, or there's a spot on our brain that is associated with that joint in our body. And if that joint's not moving, our brain is also deteriorating in that area. And that leads to a lot of different mental issues as well. So exercise, movement is very, very important when you look at that. So that's kind of, for me, baseline health is including all three elements of those, and just making sure that you're the healthiest that you can be. So
you're in Texas, we're in Ohio. I know at least in Ohio we have some restrictions, social distancing. You can't go certain places. Some people, especially in urban areas, may be restricted to even doing a whole lot of things. And thinking about movement, is your approach or has your idea, or have you changed how you are addressing people moving in this current context of the pandemic?
Yeah, I think so. The way we've set up our 90-day lifestyle plan, absolutely everything that we put in there can be done at home or around the house, right? You can absolutely follow all the social distancing stuff, all the quarantine or lockdown or whatever you want to call it, stay in the home, stay at home, whatever it is. But for me, honestly, if I could just get everybody to walk 2 miles a day, the health, there's a study called the nurses study is the generic name of it, but it was published in one of the big journals. I think it was the New England Journal of Medicine. and they showed if everybody would walk 2 miles a day, the health changes that would take place in a population. And it's like cancer rates drop by like 80%, diabetes goes down by like 90%, obesity, all these different depression, anxiety, all these different health disorders. Like there is no pill in the world that can do for us what walking 2 miles a day can do for us. So, I mean, for me, for my patients, the baseline is just get out and get moving, you know, and that's not always possible in the beginning. So we start with a walk to the mailbox or whatever it may be. But if you can get people walking a couple of miles just every day, soon enough, that's going to turn into a jog for some people. And then they'll jog a little further. And then some people will throw in some intervals or whatever it is they want to do. And we have all those different options for them, but we're just trying to help them keep moving as much as possible right now, you know, incorporating the kids, incorporating family, whatever it takes. Everybody move the dog for sure, right? The dog loves it. Oh, yeah. The best part about the walk is free, right? So it's it really makes a big difference. So
something as simple as just walking, like you said, sometimes maybe walking up and going to the different room or going to the mailbox or a flight of stairs. Something that small can make a great impact on somebody. That's amazing to me. Glad you had mentioned that.
Absolutely.
So kind of going back to my start, really not much change then from your mind of being active. Yes, it might be, you might be restricted to where you can go to be active, but can be done in your house, can be done as just in your own area, wherever you might be residing. Awesome.
Yeah, absolutely. Just stay healthy for sure.
Right. Okay. So thinking about, you know, in my mind, college students, that's who I serve, but thinking about maybe even students in general, we got pre-K through 12 through undergrad, through graduate students, everybody's online class now, a whole different change, no more being on campus. Any thoughts on how those people, that group, that population can get to wellness and stay well in this different time that we have?
Yeah, for sure. I mean, simply put, it's achieve baseline health, right? Eat well, move well, think well. But I think on a little bit more complex level, it's just putting thought into that. Planning is a big thing. I know for my kids doing the online schooling, when they first started, I was like, oh man, I don't know what to do. Just get your homework done, right? Just, if you need help, ask me.
Right.
And then I had to relearn math and everything else. But it's what we did to make things easier on them is we start right? Kids don't think about eating a salad when they're at lunch, right? Some kids do, but it's not often. So what we do is we do a green smoothie. We just throw in a bunch of spinach or kale or whatever, is make it as green as possible, and then throw in some fruit for some flavor for them, and then things like things that you can't get enough of from food, which I call our essential nutrients, which are omega-3 fatty acids, vitamin D, vitamin A, and probiotics. The good bacteria for your gut. I put those in there in the morning for them as well. We mix it up. They have fun with it. They get to make their different flavors or whatever. And that's a big portion of their diet, and it helps keep them healthy, right? And that keeps them full too. When you eat good foods like that for you, you stay full a lot longer. So that's part of our plan. And then we have planned homework time, and then we have planned outside time, right? It's like, you got to go play soccer, play softball, play catch, do whatever you're doing, go for a walk, ride your bike, do something, but we got to be active. We can't just sit around on our iPads and hope that we stay healthy or hope that we avoid a virus or something like that. We've got to be prepared for it. So I think planning is the biggest thing. And the other big thing, and this is kind of on the mental side of it as well, is when one of these things fall off, when you don't get to exercise for a day, or you eat pizza because it's there or whatever it is, don't beat yourself up for it. We all do it. Just be as healthy as you can. Health's not an all-inclusive thing, right? You can, make little steps to do the right thing, and those little steps start to pick up. It's like the walking thing I talked about earlier. If you get someone just walking a little bit, that'll turn into a jog for them eventually, and they'll start to get more and more out of it. So it's just making those little steps to achieve the bigger goal in mind, and setting those goals is a big thing. Know what you want to achieve, and then go get it. That's the biggest thing for me.
So planning that out. And I would argue similar to the physical side of things, walking to the mailbox and then to the end of the road, whatever it might be, and then you're jogging. I think can be applied to the mental side of things as well. As starting to think well can start with one thought a day and turn into, weeks and months and lifestyle worth of healthy thought pattern. So, I think that's important for people to keep
Right.
that in mind as well. So eat
Well,
well.
it's a big one.
Sorry, go ahead. Eat well,
No, you're
move
good.
well, think well. That's what
Correct.
you talk about. Eat well, move well, think well. I like that. I mean, that's a good way to start your planning, right? How do I plan? Let's think about eating well, moving well, thinking well. That's really cool, and that helps us get to that baseline health that you talked about.
Yeah,
Awesome.
for sure. Yep. Start small, whether it's eating, whether it's moving, whether it's something like meditating, meditating can be a big mountain to climb in the beginning. As nice as it is to bring that peacefulness to your life and just kind of slow down your thinking and slow everything down. You don't have to start with a 35-minute meditation. It's not that easy. So don't be disappointed with yourself. Work your way up. It's a big thing.
Yeah, I think that's a good point to make, especially when people do have anxiety, depression, when they have 9,000 thoughts a minute, and now you expect them to have zero. Like you said, that's a big step. But think about going to the mailbox. That's all I had to do today, and then tomorrow might be something a little bit more.
Right.
That's good. Cool. Hey, anything else you feel like is important? I appreciate the time that you spent with us today. Anything else you'd like to share?
I think we hit it all. It's just eat well, move well, think well, and go Berg.
Go Berg. Hey, Dr. Chris, I appreciate your time out of your day, letting us know a little bit about what you do, how you do it, and your approach to getting people to baseline health. Hopefully everybody else can benefit from your knowledge and your experience as well. Thanks again.
Absolutely. Thanks, John.